Choosy Kids is a Morgantown-based company that has a mission of health messaging for young children and their families. And we provide information and resources that contain really appropriate health messages that parents and teachers can use to promote healthy habits with young children. And we do that with really good music and a unique children's character named Choosy.
When I eat my fruit, my heart says thanks. Bum bum, bum bum, my heart says thanks. When I eat my veggies, my heart says thanks. Bum bum, bum bum, my heart says thanks. When I drink my milk, my heart says thanks. Bum bum, bum bum, my heart says thanks.
I was a professor at WVU for many years and utilized Choosy in my children's programs that we conducted on campus at WVU. And I had the opportunity in 2006 to be invited into the WVU Business Incubator, and a place where WVU encourages professors with ideas to try to grow a business. And so in 2006 we were in the Business Incubator and did really very well for a small startup business because health and certainly physical activity and nutrition are topics that concern parents and public health agencies and schools, and so there really was a market for what we were doing. We didn't have a widget that had no market. It was the health of children is current now, and it was 10 years ago when we were doing this. So the market was there. The ideas, I think, are unique and novel, and I was very pleased to be able to be in West Virginia and have products and resources that were needed all over the country. And so we are a small company, but we have a large footprint nationally. Choosy Kids is designed to offer products and resources to families who have young children, and for preschool teachers or child care centers or agencies that provide services to children birth to about age 5 or 6. Probably our signature features as a company really probably would be under music. We have children's music that is very lively and not the traditional children's music that perhaps people think about. Our music could represents a variety of genres, but the music sounds like it could be played on the radio. Adults don't mind listening to it repetitiously. And embedded in the music are very important health messages, and all of this is based on evidence from the research that there is such a thing as stuck song syndrome, and companies use it for marketing. We're all familiar with jingles on the radio that we can't get out of our head and we sing over and over again, and songs that the loop plays and plays and we wish it would stop. Well, we use that to our advantage, that by embedding health messages in really lively music that is appealing, then if you can't get that song out of your head, that means you can't get the health messages out of your head. And that's what we want.
Now sing this. I'm so happy that I'm healthy. I'm so happy that I'm strong.
So our music is very unique and novel in that way, and we've been recognized with Parents' Choice Awards because of it. Probably the other signature feature that we have, besides a variety of music CDs, both in English and in Spanish, is the children's character Choosy, which is now recognized and utilized all over the country in preschools and child care centers and Head Start programs. Choosy is very familiar to children, and so as a children's character, again based on research, we know that children's characters are profoundly influential with young children, and that could be good or bad. And so we again take this what we know to be true, and we try to have a children's character be influential in a very positive way. It really hasn't been since Popeye that there's been a children's character that promotes health and healthy eating and drinking and healthy habits like brushing teeth, washing hands, and those types of things. So it's been a long time since we've had a good, recognizable health hero whose messages are about healthy habits and healthy behaviors. So we think that Choosy's meeting a need, because I think all parents and grown-ups would want children to have a positive role model as they're developing their preferences. And so we try to develop materials and resources that children like anyway, storybooks and music and puppets and plush dolls and posters for their rooms, and things that provide parents and teachers with the tools for introducing discussion and dialogue and learning experiences about healthy habits.